My name is Ramona Moldovan, and I'm a clinical academic with a background in clinical psychology and in genetic counselling. I'm based in Manchester. I work both with the university and the genomic medicine department in the NHS. I'm very grateful to be able to give you a short presentation about genetic counselling for psychiatric disorders and share some of the work we have done recently around professionals' views on a psychiatric genetic counselling service. Probably a good place to start would be a definition or two. Many of you will be familiar with genetic counselling, but perhaps not everyone. And it might be important to highlight from the very beginning what psychiatric genetic counselling is and isn't. Psychiatric genetic counselling is often misunderstood, and people have some misconceptions about what it might be. Psychiatric genetic counselling is only for people with a strong family history of a psychiatric disorder, or for people to appear to have a genetic syndrome, or we mainly focus on questions like what are the chances that my son or my daughter might have a psychiatric disorder, or it's just for people who are interested in discussing risks or those who want genetic testing. And if genetic testing is not an option, how can genetic counselling help? Genetic testing is not currently used to confirm or predict a diagnosis of a psychiatric disorder. However, genetic counselling is not dependent on or synonymous with genetic testing. In fact, substantial empirical data supports the use of genetic counselling for patients and families, even in the absence of genetic testing. So all of these things we can absolutely discuss in a session, but we can do more than that. For example, people who have experienced psychiatric problems often feel guilty or ashamed. They may feel that they have done something that caused the psychiatric condition they have. Parents sometimes worry they did something that caused their child's psychiatric disorder, or they wonder if there's something they could have done to prevent it, or if there is something they can do to prevent it in a future pregnancy. All these questions, as well as the anxiety or shame or stigma around developing or passing on a psychiatric disorder, can be really problematic for people. And these are things we can very helpfully address in genetic counselling sessions. Fundamentally, the scope and ethos of psychiatric genetic counselling is identical to any other genetic counselling sessions. We are helping people to better understand what it is that we know from research about the causes of psychiatric disorders, about how genes and environment contribute together and leads to the development of these conditions. And very importantly, psychiatric genetic counselling is also about providing supports and counselling for people and families, and we talk about strategies they might be able to use to protect their mental health. We wanted to understand how to best expand genetic counselling to reach and address the needs of individuals with psychiatric disorders. This is how this GMSA project came about. We ran interviews and focus groups with various stakeholders. We tried to get an in-depth understanding of some of the needs and challenges and opportunities we should have in mind. This is followed by a national survey, and all this data will inform a curriculum which will then guide future training. But for today, I'm just going to present a very short summary of one of the arms of this project, led by the lovely Hannah Quigley. We decided to use purposive sampling to focus on the clinicians and stakeholders we understood to have experience of working with individuals and families with psychiatric disorders in various contexts and roles. And after a thorough analysis of the data, we identified four main themes: the benefits and challenges of psychiatric genetic counselling, the clinical and cultural context, and the opportunities for a new service. The two main benefits of psychiatric genetic counselling the participants mentioned were: one, the increased knowledge and understanding patients have following sessions, and two, the way genetic counselling can act as a therapeutic tool. And I'll leave a couple of quotes you may find interesting. I'm not going to read them out loud, but I'll leave them here for you. Participants identified various challenges as well, challenges that may impact psychiatric genetic counseling. For instance, therapeutic barriers like managing the uncertainty that comes with these conditions being multifactorial, the resources of healthcare services, managing expectations of patients as to what genetic counseling can offer, the collaboration with other disciplines. This is something all participants emphasized as being a challenge. And a quote I thought you might find helpful. An interesting theme that emerged was the context of providing genetic counseling for psychiatric disorders. Participants discussed the influence of society on patient views and attitudes, the practical challenges within services, and the use of existing clinical models and pathways to act as guides when thinking about how to implement genetic counseling for psychiatric conditions. And a very important note here, participants highlighted that all these conversations should revolve around patients' needs. And again, a couple of quotes I found quite interesting. The final theme identified several opportunities for psychiatric genetic counseling. Participants addressed the potential changes to clinicians' scope of practice if they were to work with the patient group they are not trained in working with. They suggested additional training to make sure they are up to date with research advancements, for example, genetic testing or pharmacogenetics, polygenic risk scores, and very helpfully, participants put forward suggestions of how to expand genetic counseling to this patient group. A small number suggested the creation of a bespoke psychiatric genetic counseling clinic within current genetic services. This would utilize existing resources and the skill sets of the genetics professionals who regularly address multifactorial inheritance and are very experienced in managing uncertainty. Many participants suggested an ad hoc MDT of psychiatrists, psychologists, geneticists, genetic counselors, social care workers to review and assess complex cases. This would utilize the skill sets of a wide range of professionals and address the various needs of the patients if and when needed. But the majority of participants felt that psychiatric genetic counseling would probably be best integrated into the mainstream, such as, for instance, current mental health services. One of the reasons being that it would reduce the clinical burden and potential distress on patients of attending different specialist settings. The other advantage here is that it would also benefit from the advanced skills and understanding of patient needs that mental health professionals have. Of course, all of these options come with the need for additional training, and this is something we want to look into next. This is certainly a very exciting area of research and practice, and with inevitable implications for current and potential new services. There is great interest and support from patients, families, and clinicians. And we would be very grateful for your input. So please get in touch if this is something you're interested in or would like to contribute to. And I am very grateful for the opportunity to talk about some of our work. Thank you.